Aminoglycosides. Aminoglycosides are a group of potent antibiotics effective against gram-negative bacteria and some gram-positive bacteria. They can be used in two main forms, systemic and local. Systemic use. Given via IV or IM for severe infections like sepsis and severe UTIs. Local use. Used as eye drops, ear drops, or creams for localized infections. Systemic aminoglycoside should only be used during pregnancy if no safer alternatives are available. They should be given only when the benefits of treatment are greater than the potential risks. 1. Gentamicin. Gentamicin 80 mg. FDA. Category D eye drop. Category C. TGA. Category D. Gentamicin is preferred during pregnancy due to more documented experience of its use. Gentamicin has a minimal risk of causing auditory or vestibular nerve damage in the fetus, particularly when used during the second and third trimesters of pregnancy. Preferred regimen during pregnancy: once daily dosing. Loading dose: 5 to 7 mg per kilogram. Maintenance dose: 5 mg per kilogram once every 24 hours. Duration: typically 48 to 72 hours, adjusted based on clinical response and culture results. For a 100 kg patient. Loading dose: 500 to 700 mg. Maintenance dose: 500 mg once every 24 hours. Therapeutic drug monitoring (TDM). Gentamicin levels should be closely monitored due to its narrow therapeutic index. Target peak levels: 5 to 10 microgram per milliliter measured 30 minutes after the dose. Target trough levels: less than 1 microgram per milliliter measured just before the next dose. Gentamicin is considered safe for localized, short-term applications, e.g., skin, eye, or ear infections during pregnancy due to minimal systemic absorption. However, avoid applying it to large body surfaces or using it for prolonged periods to reduce the risk of systemic exposure. Apply a thin layer 2 to 3 times a day for 7 to 10 days. For non-critical infections, alternatives like bacitracin or mupirocin may be preferred to further minimize theoretical risks. 2. Streptomycin, streptocaine and Entocid tablet. FDA, Category D. TGA, Category D. Strongly discouraged in pregnancy due to association with an increased risk of 8th cranial nerve toxicity in the fetus leading to hear loss and vestibular dysfunction in the infant, particularly in the second and third trimesters. This risk is highest with streptomycin, while it is likely minimal with gentamicin and tobramycin. 3. Amikacin. Amikacin 500 mg. FDA, Category D. TGA, Category D. Use: treats severe, resistant gram-negative infections like sepsis only if safer antibiotics fail. ACOG supports cautious use of amikacin with monitoring when maternal benefit outweighs fetal risk, while RCOG advises avoiding it unless essential, with strict monitoring. Evidence suggests low ototoxicity, nephrotoxicity in short-term use, but prolonged therapy greater than 5 days increases hearing loss risk, with no confirmed birth defects. Dose: for a 100 kg patient, the recommended dose of amikacin is 15 mg per kilogram per day, which equals 1500 mg per day. This can be divided into 2 doses. 750 mg every 12 hours, 7.5 mg per kilogram per dose. Topical, local aminoglycosides, not expected to cause significant systemic absorption. May be used during pregnancy when indicated. Tobramycin, Tobran eye drop, has a minimal risk of causing auditory or vestibular nerve damage in the fetus, particularly when used during the second and third trimesters of pregnancy. FDA, eye drop. Category B. Inhaled. Category D. TGA, Category D. Dose: 1 to 2 drops in the affected eyes every 4 to 6 hours, depending on the severity of the infection. Tobramycin eye drops are generally considered safe for use during pregnancy, as they have minimal systemic absorption. Similar precautions as gentamicin. For inhaled formulations, systemic absorption is minimal but should still be used cautiously in pregnancy. Neomycin, FDA Category D. TGA Category D. Neomycin is generally not recommended for systemic use during pregnancy. Neomycin has the potential to cause eighth cranial nerve toxicity, fetal ototoxicity, and nephrotoxicity, though systemic absorption is minimal with topical or oral use. Topical neomycin can be used cautiously when benefits outweigh risks, as evidence suggests no proven teratogenicity or congenital anomalies with proper use. However, high doses or prolonged systemic exposure may lead to fetal hearing loss, similar to other aminoglycosides. Netilmicin, netoftiol eye drop, occasionally formulated as ophthalmic drops for bacterial conjunctivitis or corneal infections. When used topically in pregnancy, systemic absorption is minimal, reducing fetal risks compared to intravenous or intramuscular administration.